Welcome back to the OHSU Effect, and it's time to cover another topic about our kids and prepping for back to school. We're talking about eye checkups and what parents need to know about their children's vision. With us now on KXL is Dr. Ann Stout, pediatric ophthalmologist at the KCI Institute. Hi, Ann.
Hi.
So it's back to school time, and parents are often thinking about checkups and physicals, but this is probably a good time to get your child's eyes checked too, right?
Well, that all depends. If they've worn glasses in the past, it's a good thing to make sure their glasses are up to date. Usually the primary care doctors do a pretty good job of screening their vision, and so routine eye exams prior to school aren't always recommended. But of course, if you have a concern, summer's a good time to get that checked.
Should children receive eye checks regularly or only when they're having vision issues?
Their regular eye checks are not recommended for children based on the guidelines of multiple organizations such as the American Academy of Pediatrics, American Academy of Ophthalmology, because most children will not have vision problems. They should be checked in their primary care home by their physicians, and that's part of routine eye care. And if those doctors detect a problem, then they will refer them for eye exams. Of course, if you notice problems with your children's vision, then you would want to get them checked. Or if you had a family history of somebody in the family having a lazy eye or a crossed eye, you may not notice a problem there, but those children also need to be checked.
Well, what are kind of the signs that your child is having trouble with their vision?
Signs you might see are getting close to things to see, squinting when they're trying to look at things, turning their head or tilting their head. They may have complaints such as headaches or really not liking to read, complaining their eyes hurt after they read. And so those are some of the things that children might complain of. But a child could have very poor vision in one eye, and their other eye would compensate so well that you wouldn't recognize they had a problem. And that's where being aware of your family history is important and making sure that their regular doctor is screening them to make sure that each eye sees well.
Has there been significant changes in vision correction for kids?
There have not been a lot of significant changes as much as for adults. Refractive surgery is the biggest change for adults, and although children can have refractive surgery, such as LASIK, their eyes are still growing and changing, and so often that's not recommended until they're older. The only other big change is the use of lens implants. Children can have cataracts just like adults, and lens implants are used in adults, and now they're being used more routinely in children to correct cataracts.
Well, let's talk about contacts then, because, maybe a lot of teenagers might not want glasses. What is your advice when it comes to contacts in teens? Is there a best age for that?
Contacts are very popular with teens, and sometimes parents are anxious for their children to start contacts even earlier because of sports or being afraid their children are going to be teased about wearing glasses. Usually around age 11 to 12 is the safest age. That's the age when children can start to be more responsible. They have to have good personal hygiene, like being able to brush their teeth without being reminded, because contact lenses do carry a risk of infection, and the child needs to be responsible enough to manage them.
Is there anything else parents and doctors should be more aware of when it comes to young kids and vision?
Well, an important thing is eye protection. Just like children nowadays are recommended to wear helmets for bike riding, there are certain situations where children should always wear eye protection. Paintball is a popular sport, and although eye protection is routine for that, children often remove the goggles briefly to wipe their face, and that's when they get hit with the paintball. So eye protection for high-risk activities such as paintball, high-speed ball games, racquetball or squash, or just hammering metal on metal without eye goggles, all of those can cause eye injuries to children.
Well, let's talk about the eye exam, because maybe kids might be frightened by that, maybe frightened by going to the doctor in general. So what can we do, and what do you guys do up there at the KCI Institute to kind of diminish those fears?
Well, first of all, you can reassure them right away that we have no shots. We often do have to dilate their eyes, and that involves putting a drop in each eye that does sting for a moment, and that can be alarming for children. The way we try to make it friendly is we have games, we have movies they can watch. We really try to make the exam a little bit more like a game. And getting the drops is probably the only slightly frightening part of the exam.
Tell us about the other pediatric services available at the KCI Institute.
Well, children can have the same eye problems as adults can. Everything from glaucoma, cataracts, retinal problems, and all of those are treated at KC. KCI Institute is also involved in a study looking at lens implants for newborns with cataracts. And they're one of the first institutes looking at a study for gene therapy for certain retinal diseases in children.
Is there a phone number or a website, or if parents want to contact you for an appointment or more information?
Well, all of the contact information is available on the KCI Institute. You can find providers. The pediatric eye clinic there is the Elks Children's Eye Clinic because they are one of our big supporters. And all of that's available on the OHSU website.
Great. Dr. Stout, thank you so much.
Thank you.
Thanks for joining us this week on the OHSU Effect. More great doctors next week, including one who researches pediatric obesity and the negative effects our neighborhoods have on kids. That's all next week on the OHSU Effect, Inside Health and Science at OHSU. Join us again on KXL.